Hi, we will talk about cervical spondylitis, which is a kind of a chronic neck pain, what is also called as the right neck. And it is so common, especially with the increasing use of mobiles and desktop and laptops that most people from childhood have been using now is becoming extremely common. World's 20 to 70% of the world population suffers with cervical spondylitis, as per the estimates. We'll talk about the prognosis or the scope of treatment of cervical spondylitis using homeopathy. My name is Dr. Rajesh Shah. I'm a medically trained homeopath and the director of Life Force, where we treat patients of all kinds of chronic diseases from all over the world. My suggestions in this video are on the basis of documented cases of over 400 cases of cervical spondylitis and related conditions. Cervical spondylitis is caused by various factors which include aging factors, lifestyle factors, the wrong posture while doing the desk work, working on the computers, working on the desktop, using the mobile, and so on. So there are some physical factors, there are some stressful factors. The people living a very stressful life, they have muscle spasm that also leads to inflammation eventually of the cervical spine, producing the pain. The severity vary from patient to patient. Some patients may have very mild symptoms. Some patients may have extreme symptoms such as complete stiffness of the neck. And for that, one may have to evaluate and rule out other related conditions such as ankylosing spondylitis. A good MRI or CT scan will throw a light about the extent of the pathology, if there is a just mild inflammation due to aging process, or if there are some severe changes in the spine including the spondylolisthesis or some kind of disc bulge, etc. So homeopathic treatment and the success with that will depend on the extent of the pathology, extent of the disease, and the severity of the symptoms. Most cases of cervical spondylitis may respond reasonably well to homeopathy. There could be significant pain relief without using the painkillers or anti-inflammatory medicines. That is what is achievable with homeopathy. Homeopathic medicines can reduce the inflammation, can reduce the spasm, can give relief in the pain, stiffness, and can improve the mobility in the cases of cervical spondylitis. However, homeopathic medicines cannot reverse the pathology of chronic degeneration in the cervical spine. Needless to say that. Homeopathy, is it recommended? Yes, of course, homeopathy is strongly recommended in most cases of cervical spondylitis. And there is no point in taking chemical based painkillers for a long time because they will have their own side effects. So homeopathy is safe, effective. It may take little longer than the regular painkillers in many cases. However, we are looking at a long term benefit and long term relief and control of the disease. So homeopathy is strongly recommended. The duration for homeopathy treatment vary from around 4 to 6 months or little longer depending on the severity of the case. And of course, homeopathic medicines could be taken even if you are taking some other medicines for your cervical spondylitis. Some amount of physiotherapy and exercises are very much required in many cases of cervical spondylitis, and physiotherapy and homeopathy, of course, will go hand in hand to get the best possible results with these two modalities. I hope this video will help the patients suffering with cervical spondylitis as well as the doctors and medical students. Thank you so much for watching.